In my district, which includes the city of Los Angeles within LA County, LA's annual homeless count released their last report in June of 2020 and stated that about 66,433 people are now living on the streets, in shelters, and in their cars across the county. This is an increase of 12.7% since 2019. Within the city limits of Los Angeles alone, there has been a 4.2 increase over the last year, resulting in 41,290 people experiencing homelessness. The slice of homelessness in the city of Los Angeles alone is unparalleled. Amid COVID-19, the unemployment rate in Los Angeles County was 20% at its peak. For reference, LA County's population is 10.4 million. That means close to 2.8 million people in Los Angeles County alone were unemployed and worried about housing and their livelihoods. Across California, at its peak in May and April of 2020, the unemployment rate was 16%. That's roughly 6.4 Californians without a job, without means, worried and wondering and frightened for their future on the brink of homelessness, adding to already existing exhausted resources. I bring these numbers up to share that we are talking about real human lives impacted by living paycheck to paycheck, struggling amid the pandemic, mental health challenges, unemployment, looming evictions, gentrifying neighborhoods, increasing rents, and generally a lack of affordable and low-income housing. Human beings are impacted by chronic, episodic, transitional, and hidden homelessness, and all of us here have been charged with being good stewards of our state budget, the public trust, and ensuring basic rights. It is my belief that every human being has a right to housing and a right to live with dignity. For today's hearing, we have 3 panels on the subjects of overview of the state's role on homelessness, local perspectives, and lastly, recommendations from experts. It could be a question for all 3 panelists, but my own personal interest, of course, is the city that I represent, the city of Los Angeles and the county of Los Angeles. But I think this question specifically is related to our current experience in COVID-19. And I'm just wondering if, given the role of various tenant protection policies, such as eviction protections, rent stabilization, and various anti-displacement strategies that the state is moving forward with in the prevention of homelessness, what work do we need to do from your perspective to straighten these kinds of policies? Do they work? Do they not work? And what is the conversation on the ground? And I appreciate that you have all touched upon it on various different points in your presentations, but I think that we are facing a dire situation, and I'd really like to know from your perspective, what is it that we can do to be more effective? I could not agree with you more in terms of the regional approach and the equity approach in terms of our most impacted. And being from Los Angeles, I know exactly what you're talking about. I would love to continue the conversation on family homelessness, perhaps when we have more time during the Q&A of this panel. But I think that's a very interesting topic in terms of keeping the family together and keeping the family unit safe. In our conversations, we've spoken before about the bureaucracy of being able to move with urgency. Can you please share with us what are some things that maybe the state can do to remove some of that red tape that does not allow for the counties to move as quickly? Or what are some of the bureaucracies even within the county that does not allow for assistance to move at the level of urgency that it needs to move at? And what can we do to help? How can different potentially siloed systems like healthcare, child welfare, criminal justice, and housing be aligned to prevent homelessness? I want to thank all the members of the joint hearing today in housing and homeless and budgets of 4 for participating and engaging in one of the state's biggest challenges, housing, homelessness, and trying to come up with creative approaches that are different than what we've been doing in the past to address this very real issue that communities are feeling on the ground. I opened up my comments early on by stating that this is an issue that is about human lives. It's an issue that impacts human beings that are homeless on various different levels, chronic, episodic, transitional, and hidden homelessness. And there's so much that so much to take away from this very robust conversation that I think has given us ideas in terms of what can the state do to be more helpful, more engaged, have regional approaches to various different issues related to housing and homelessness, including mental health, and how conversations are often in a silo, and they shouldn't be. The conversations need to be completely inclusive with conversations on solutions and pathways to solutions.